My name's Bruce Braithwaite. I'm a consultant vascular surgeon. So my role at Circle is to provide care to patients who've got problems with their arteries or their veins. I also have a role helping Circle manage their hospitals, including their overseas facilities, including those in China. Well, in terms of my research interests, I've done a lot of work on the management of a condition called aortic aneurysm. But the main thing has been the treatment of patients with varicose veins. Varicose veins are a very common problem. They probably affect about 1/3 of the adult population, although I have treated children and teenagers. The main problem they give is patients don't like the look of the varicose veins on their legs, which are large, lumpy, rope-like things, or they have spider veins, which are a bit like starbursts on the skin. And that stops them wearing skirts and shorts and perhaps taking children swimming and the like. And we deal with those in keyhole ways to improve the appearance of the legs. There are other reasons for patients wanting their varicose veins treating, and that could be leg ulcers, and that's quite a common condition, can be painful for patients. And we've got some fantastic treatments which allow us to treat the patients, again with keyhole techniques, taking only a few minutes to perform, and then their leg ulcers heal up. So the most common symptoms patients get when they've got varicose veins are either the appearance, or more commonly aching in the legs. They sometimes get swelling towards the end of the day. Sometimes they have fidgety legs at night time where they can't get comfortable. And when varicose veins cause serious problems, you can start to get colour changes around the ankle where you've got a brown discoloration. And at worst, you then develop a sore called an ulcer. And that's usually in the area of the ankle. And you really need to see one of us as a vascular surgeon to get that fixed. It's quite a complex reason why varicose veins develop. We don't fully understand it, but most people have a family member. So I would say about 9 out of 10 people who've got varicose veins have got someone, a close relative, who's got them. And the problems that they cause is to do with too much blood pooling back down in the veins around the ankle. And that causes the inflammation, which gives rise to the aching people get, as well as the look. And when it's worse, the inflammation causes damage to the skin. There's a condition called liposclerosis, which is a fancy medical name for fat hardening. And that can then lead to the ulcers. When you come to see me in a Circle clinic, I'll listen to you to find out what it is you'd like to know about your varicose veins or the treatment you want. We will then try to give you what's called a one-stop approach, because you may need to have something called an ultrasound scan, which is when one of our scientists will use sticky jelly to examine how the veins are working in your leg. And all being well, you'll actually leave the consulting room knowing what's wrong with you and knowing what treatments we can do. And if you've come to see me, I'll almost certainly have actually given you a date to get the treatment done. And I'll provide you with lots of information, including a system called the IDO information leaflets, which allow you to understand the condition and the treatment much more clearly. Well, we've got several ways to treat varicose veins. And in the past, people used to have something called stripping, which was quite painful, and a lot of people don't like the idea of having their veins treated because of that. But we now have very modern keyhole techniques which are much less painful. So we can either heat seal the vein using endothermal ablation. Some people may have heard of that as laser technique. We can use special injections, something called foam sclerotherapy, which is all done under local anaesthetic and takes literally 5 or 10 minutes. And we can use a technique called microsclerotherapy to deal with the kind of bluey red spider veins that people have on their legs. Well, the main treatment for varicose veins, and ideally the gold standard, is something called endovenous ablation. And if you look at all of the research we've done, that gives the best outcomes. And what we do with that is we heat seal the vein, usually in the thigh, sometimes in the back of the calf. And that essentially stops the blood running through the vein, and the body then gets rid of the vein that's been heat sealed. Patients will see the result very quickly afterwards. Sometimes that technique is combined with something called multiple avulsions, which is where we make tiny little nicks in the skin to remove some of the lumpy veins. And in terms of discomfort, it's no worse than possibly being pushed into a thorn bush. The patients who come and see me tell me that they are back on their feet almost immediately after the operation. They have to wear bandages for 2 days. Then they go into some compression stockings. But a lot of people are back to normal activities within 2 or 3 days. Patients choose to come to Circle because it has a philosophy of always putting patients at the centre of the treatment. It's not about the doctors, it's not about the nurses, it's not about the hospital. It's not really about money, it's just making sure that patients leave having their problem fixed, because we make patients the centre of attention at Circle.